Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. Today I'm going to talk about a very common and an important topic, contraception. So how do we doctors decide what contraceptive is needed for you? We see variety of patients. Let's say we have a sex worker, or we have a lady who has already delivered 3 kids, or we have a lady who is having excess of menstruation, or there is a young career oriented lady who wants to postpone her pregnancy. So we see varieties. It's not just to prevent the childbirth. The reason I gave you the different case scenarios is your contraceptive is not only useful for preventing pregnancy, but also it has other beneficial effects. So what would be the right contraceptive for you is what I'm going to talk to you about today. In contraceptives, we have different forms of contraception. There's something called as temporary contraception and there is something called as permanent contraception. So in temporary contraception, we have physical methods. There are 3 types of physical methods. One is abstinence during your safe period. So what is this safe period? Basically, there is a period of ovulation which is considered to be 14 days prior to your next periods. And during this period, the chance of pregnancy is much higher. So we have a window period which is actually pretty small, during which your sexual intercourse is considered safe. So how do we calculate the safe period? Let's say you have a cycle, the shortest is 28 days and the longest is 35 days. So we subtract 11 from your biggest cycle and we subtract 14 from your smallest cycle. So based on this, during that period, you are not supposed to have your sexual intercourse. You can have it prior to that and after that. So how reliable is this method? Let me tell you, it is not much reliable because the failure rate is pretty high. The second method is called as coitus interruptus. Basically, you're having a normal sexual intercourse, but just prior to ejaculation, you are withdrawing. So hence, you are not letting the sperm come in contact with the ova, hence you are not getting pregnant. But again, this is not a foolproof method because some amount of semen will be there during your sexual intercourse. So again, the failure rate is pretty high. The other or the last natural method is lactational amenorrhea. That is, you are a mother who has delivered a baby and you are breastfeeding the baby at least for every 4 hours, once in the daytime and once in 6 hours in the night time, and you haven't got your periods yet. Your baby is less than 6 months old. You're not giving any other top feed or formula feed. During this time, sexual activity is safer because of your natural hormones. But again, this is not a foolproof method. These are for people who are very conservative, who do not want to go for any medications. You can follow these natural methods. But again, you have to consider this with a pinch of salt because none of these are going to be 100% foolproof. Now coming to the other temporary methods. So in that you have something called as barrier method, where you're putting some physical barrier to the sperm coming in contact with the ova. So we have something called as male condom, which a lot of people know about. So this is worn right before the sexual intercourse. This not only prevents pregnancy, but it also prevents sexually transmitted diseases. This is very useful for sexual workers. This is useful for young adolescent children who are going for early sexual intercourse, and for those who do not want to go for any pills, you can go for this. So in this method, you might have some amount of side effects like irritation, foreign body feel and all, which can be taken care of by using lubricants. Again, there are about 1 to 5% of failure rate depending on what sort of condom you are using. When we talk about ladies, yes, there is something called as female condom. This will be slightly bigger than that of a male condom because this is going to cover the cervical entry and the vaginal area. it has, instead of one ring, this will have two rings. So it is almost similar to that of male condom. The maximum failure rate for male condom is 14%. The maximum failure rate for female condom is about 15%. But if you are a sexual worker, then definitely this would be one of the ideal methods that you can use. Another method, these are all, whatever I'm going to talk about further on, are for ladies. So the second one is called as diaphragm. This is worn in the vaginal area. This should be worn at least 6 hours prior to the sexual intercourse and can be left inside for about 6 hours after the intercourse. And when you're using this, definitely you are supposed to use spermicidal agent. They come as vaginal tablets, they come as suppositories, they come as gels, they come as creams. So you can apply the cream or the gel to the surface of your diaphragm before you use it. This will ensure your contraception. So the failure rate would be much lesser. Similar to this, you have another thing called as cervical cap, which is placed in the cervical area. So diaphragm or cervical cap, you need to be taught how to use it. Once you learn how to use it, the failure rate is much lesser. In the initial 1 year, when you are in the learning curve, at that time the failure rate is much higher. It can go even up to 15 to 20%. But once you learn it, it can be as low as 1%. So when you're using the cervical cap, again, you're supposed to use the spermicidal agent. Just like the diaphragm, this also has to be worn prior to your sexual activity. You have to wear it at least 8 hours prior to sexual activity, and you can keep it for as long as 48 hours after the sexual activity. The problem with these modalities is there is a condition called as toxic shock syndrome. That is, let's say it gets infected because it is left, or you had an erosion, or there is some bleeding spot or some injury in the cervical or the vaginal area, then this infection can spread to the rest of the body and result in toxic shock syndrome. So you have to be careful whenever you have an infection. Kindly refrain from using it. The best would be to avoid sexual activity during that period of time. We have something called as spermicidal agent. So these, like I had mentioned, are available in vaginal tablet form, they are available in pessary form, they are available in suppository form, they are available in gel form, foam form, cream form. So you can use whichever you are comfortable with. These again will kill the sperm, thereby preventing a pregnancy. Again, all these things comes with a bit of failure rate. I hope this video was useful for all of you. I would want you to follow me for further updates on your medical awareness. Thank you.